very gently. You can see how hard you need to push with someone, but you can just get a nice little push from here. So your hands, you should feel that ridge of muscle under each one. You're not going directly over spinous processes. And then if you do want to do the rotation, that's where you can find a spinous process, you can find transverse process. I can give a little pressure one side to work rotation. I can feel the spinous process below, so if I need to come in and rotate but block the one below, I can block with my thumb and give a little push. Very important for your own health, your own body, is that you're using as much body weight as you can, that you're locked in position with your scapula and your own body weight, that I'm not just pushing with my thumbs. People who do a lot of manual therapy, they make certain little apparatus for fingers. There are little mobilizer, little wedges, little, I don't know what you would call them, just the little tools that you can push with instead of using your own hands. They make gloves that you can wear so you can get a grip on someone. So there are lots of different apparatus that people come up with because they start wearing out, getting arthritis in their hands, and that can challenge your ability to perform. Okay, would you roll over onto your left side, facing me, please?
Left side.
Yes, please.
Yep.
Thank you. All right, so here if I wanted to do a little bit of mobilizing into rotation as well, I'm going to take your lower hand and pull you, so rotate onto your back. Perfect, and then just, you can cross your hands there. So I could hold on to Brian and hold at a certain segment here, and then I can push him, so I can move his spine. So if I went to a certain segment, I can hold, I can push and rotate. If he's not rotating well through his thoracolumbar junction, I can just facilitate that. Okay, so oftentimes we'll straighten the bottom leg, so straighten the bottom leg for me. So I can lock him into place. So he's rotated, so he's not going to be rotating so much through his upper thoracic spine. I'm trying to get at a certain level here at thoracolumbar junction here, so I can hold him, hold here, and give him some push. And then this is where I can then say, all right, Brian, so when you go home, I want you to put this top hand behind your head, I want you to put this bottom hand behind your knee, and I want you to rotate back, and then come forward for me. So I can mobilize him and then give him a home exercise to keep that movement. Because remember, if we move something and we don't then move into that range of motion, we lose, especially in the muscles, we lose that ability to move. So I can give him a home exercise. I've just mobilized him. Now here's your home exercise. Do this.
So if you want to get rotation, you get a more, if